This podcast represents my opinions and the opinion of my guests. This is not medical advice, and I'm not establishing a physician-patient relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each person is so unique, please consult your healthcare professional for any medical questions that you may have.
Welcome, everyone. You're listening to the very first episode, the inaugural episode of the Not Your Doc podcast. I'm your host, Vanessa Diedrichson, and I'm here with the star of our show, Mr. Not Your Doc himself, Dr. Charles Tadros.
Hi,
Say
Vanessa.
hey.
How are you?
We're good.
Nice to see you.
Good to see you, too. I'm glad that we actually get to do this, make some progress and a finished product for all of our many hours of jabbering away.
Yes,
at
you're
the
right.
clinic.
Absolutely. There's lots of information, a lot of experience that we're going to bring together with some scientific data to help our guests and listeners know more about medical care in general, and it's mental health, physical health, spiritual health.
Sweet. Okay, so basically we're going to give you guys a little overview of who we are, why we're here, what we're doing this for. Obviously, it'll always start with the fact that Dr. Tadros is not your doc.
That's right.
And if you need help, where should people go, Dr. Tadros?
I want everybody, because I'm a primary care physician by training, to have their own primary care physician or their specialist, or for emergencies, certainly any of the emergency services that are available through 911 if they have medical or mental health emergencies, and for suicidal ideation, suicidal thoughts. There's a national number that we're going to put at the end of the show.
Yeah, that new 988 number is working well, too, for mental health. That's certainly active in Missouri now. Okay, so just one more time so we're totally clear. What are we not here to do, Dr. Tadros?
We're not here to give specific medical advice for any of your conditions. We are going to talk about generalities, about general medical conditions that we see all the time in my practice and in our clinic.
And broader stuff than that, too, right?
That's right.
Yeah, how it affects people and the emotional aspects that are brought into it. I think it's going to be a good time. All right, so we're speaking today in the Midwest Institute for Hearts and Minds studio. You and I both work here.
That's right.
Tell us a little bit about Midwest Institute, Dr. Tadros.
Yeah, I'm a co-founder with Dr. Farugi. We started talking 8 years ago about the use of ketamine as add-on therapy for antidepressants for people with treatment-resistant depression. So we started talking 8 years ago, started going to meetings, and about 6 years ago we started infusions. It's an IV therapy with ketamine, which is an anesthetic, but we don't actually use it as an anesthetic in our office. We use it subtherapeutically. It means much, much lower dose than you'd get if you were going under for anesthesia for surgery. And it turns out that people accidentally over many decades have figured out that low doses of ketamine repeatedly used can help people with what we call treatment-resistant depression. This is depression that is resistant to being treated with the typical therapies like Prozac and talk therapy.
Yeah, that's awesome. Are we finding overall that we're having pretty good results with people?
Yes. Our patients don't come to us just because of depression. They oftentimes have other comorbidities, other things that are going on, anxiety, OCD, PTSD, which is post-traumatic stress disorder, chronic pain. But we're getting responses probably in the 70 to 80% of the people that use our therapy. It's not a cure, and it's not FDA approved for any of the conditions, but fortunately in the United States, the FDA, once it approves a drug like ketamine, medical practitioners can use it for whatever is medically deemed necessary. And fortunately, it's become unofficially a standard of care for treatment-resistant depression to use ketamine as additional therapy if other therapies haven't been helpful for depression specifically.
Yeah.
Yeah.
So what's specifically your role at the clinic?
Sure, I'm a co-founder. I'm an internist by training, a primary care physician, so I spent many decades, about a little more than 2.5 decades, talking to people, understanding all their concerns, all their health concerns, and as well as their family history, their social history, their medications, what testing, what specialists that they've seen in the past. So I kind of put it together, and that's what I use here. We meet with patients and their families or patients and their loved ones whenever they're referred to us, and I'm the one that sits down with them, typically an hour and a half plus, at no cost to them. It's just a way for us to understand where the patient's coming from, when the person or client is coming from in terms of their health, what their hopes and expectations are, what they've heard about ketamine, and for us to meet expectations, we have to understand quite a bit about the patient, and for them to be able to see us, talk to us, visit the clinic, and then they can make an informed decision if they want ketamine or not. Absolutely.
And how you and I know each other actually, started with me sitting across from you in one of those conversations.
We're gonna go there. Okay,
yeah,
good.
Absolutely. I was a patient at Midwest Institute for Hearts and Minds in very beginning of 2017. So my relationship with you and Dr. Farugi and Aaron goes back that far. And then since July of last year, I've been serving as the patient care coordinator.
That's right.
So whenever anyone calls in, sends an email, a text message wanting more information, I'm the one that communicates with them. I set up those meetings with you. Sometimes I share a little bit from personal experience about what to expect for the whole process. But, typically I'm doing everything else except for injecting people with drugs. So,
that's right.
But I feel like we make a pretty good team.
Yep, Vanessa is the first contact for almost anybody, whether it's by phone, by email, by text. She's the first contact, pretty typically, for our clinic, and she's done a fabulous job. And as we would have liked to have brought you on much sooner, but what good timing for us, and hopefully it's for you too.
Yeah, it's worked out great for me as well. Absolutely. Okay, so Dr. Tadros, tell us a little bit more about your past experience and what you do now as a physician.
Sure. My mother, way back in mid to late 70s, had significant depression as part of her bipolar disease. So bipolar is manic and depression, and her depression was severe. And back then, we didn't have as many medicines as we do now. But besides medicines failing her, we used to drive all the way from Southern Illinois, where we lived, to St. Louis for ECT, electroconvulsive therapy or shock therapy. That's how bad her depression was. By the way, ECT is still available as an FDA-approved treatment for treatment-resistant depression. It's probably the gold standard still for decades now, as the best way to relieve depression. Has failed everything else. But so that's my interest started there because it ran in my family's depression, and I eventually went to med school here in St. Louis at St. Louis University School of Medicine, and eventually did my residency at St. John's Mercy Medical Center. Now it's called Mercy on Ballas, and I started as an internist, primary care physician, took care of people from 15 years of age till they passed away. So I've been fortunate to see people through many years, if not decades, of health and illness. And eventually, many years ago, I started back then it was St. Anthony's, now it's called Mercy South, as a hospice medical director. So I added that to my primary care. I was doing it simultaneously, and now I just stopped working as a primary care physician about a year and a half ago. So I'm doing a little bit of hospice, but almost all my time is with the ketamine clinic, the Midwest Institute for Hearts and Minds.
Yeah. So given your very rich history and experience, you've got a bunch of different things contributing to your interests. What are you the most interested in helping people with now? Yeah,
what I found over almost 30 years of taking care of patients as primary care is that I repeat myself a lot for a lot of common conditions, common complaints, common conditions, whether it's hypertension or obesity or depression. And it turns out that these are really chronic conditions. That means that they tend to last a long time. Some of them are not curable. And so if you break a leg, you're better in 12 weeks with a cast or a pinning. If you have strep throat, you're better in a few days with amoxicillin. But the stuff that I tended to repeat myself on over and over again, whether it's to the same patient or different patients over time, is these chronic conditions. And depression, it happens to be one of them. Anxiety, OCD, addiction, PTSD, chronic pain. These are very difficult, debilitating diseases that cost the patient and their loved ones a lot of time, energy, and money. Costs the system, the medical system, a lot of energy and lots of energy from practitioners, and a lot of money. And so what I recognized is I was helping a diabetic not lose their leg or go blind, but I was not making I was not cure their diabetes.
Yeah.
I can help a person after a stroke or heart attack not have a decrease their chance of another stroke or heart attack, but I was not removing the atherosclerosis from their arteries or the AFib from their irregular heartbeat that caused their problems.
Yeah.
So what I recognize is that there's a lot of stuff that can be done that's outside the medical system way earlier, and that's part of what we're going to bring into our talk. Not always going to talk about depression and anxiety and PTSD, but we're going to talk about medical stuff that as a primary care physician I dealt with. And we're going to incorporate all these things in how people really live every day.
Yeah, absolutely.
That's important. And include their family and their friends, because chronic illness is not just in your body; it extends beyond.
Absolutely, into your whole circle for sure.
That's right.
I know that you and I are pretty similar in that we're external processors about a lot of things. We make a lot of connections in our brains and see connections between so many different things, whether it's about patients or ourselves or our families or our memories or our personality traits. And your main outlet for these thoughts has been your blog called the Not Your Doc blog that you've been working on for how long now?
About a year and a half now.
Okay.
I guess it's, yeah.
About a year and a half now. So, I mean, like, talk about how that has kind of been an inspiration to, or at least a workshop for what we're going to be doing with the podcast.
You know, some people journal and other people just let stuff stew in their noggin for a while. But as I kind of retired from primary care about a year and a half ago, I needed an outlet because I was not talking to patients directly as much anymore for primary care. I was certainly doing it quite a bit for our clinic, our ketamine clinic, but I recognize that the same thoughts keep coming up and over and over in terms of how to help people, what kind of recurring problems people are seeing and having, how it affects them. So I started just writing kind of thoughts that popped up as in terms of conditions and associations and with treatments, et cetera. So I started kind of listing it, and it's a small blog, but I have over 500 entries and another 700 entries that I haven't published. So I've a lot of stuff bouncing around in my head for many years.
Lots of thoughts, yeah.
Many years, yeah. So it's fun.
So, okay, cool. So, what big overarching ideas do you think you've kind of distilled down from that you really want to bring forward with this pod? Yeah,
good question. Number one, if you become part of the medical system, it's kind of envelops you. It's paternalistic in a positive way.
As positive as it can be.
Right. Yeah. If you come in with a problem, it becomes problem focused. So it's not holistic. And I'm not talking about buying herbs and vitamins and stuff like that, but just an overall arch. If you have back pain, how do you sit? How do you sleep? What's your work? How much weight have you gained? And, what have you done in the past whenever you've had back problems? So all these things that we recognize that once you're plugged into the system with any chronic condition, pain, depression, anxiety, you end up going down this rabbit hole of treatments and some successes, a lot of disappointments and lots of recurrences. And that ends up filling my day as a primary care physician, a lot of chronic stuff that's also recurring, that gets better for a while or improved, and then it kind of relapses. Yeah. So I think we can empower people. We're not actually giving them power. They already have the power. We're highlighting for them what they can do. And I think a lot of stuff is just not explained well. I think people's beliefs about how they get ill and how to get better, especially coming from somebody like me, an allopath, an MD, as opposed to a lot of the integrative and complementary and alternative medicine and other professions. I think it carries some weight that whenever I tell you I could put you on 3 and 4 diabetic medicines and I could help your A1C, your 3-month blood sugar control, but it comes at too great of a cost. Even though I know how to do it and I know where to send you, it just is too great of a cost.
Sure. So what do you think would be the goal of kind of arming people who are listening with this kind of information? What do you hope they can do for themselves?
Yeah, like anybody who teaches is not just what to think, but how to think, how to look at yourself, how to look at information, where to go for resources, how soon to go for resources, and how soon to ask for help. I think it's part of what I want people to do. It's not necessarily specifics, because whether it's depression or back pain or anything, irritable bowel, there are a variety of issues that confound. But I want people to think how I would think through the problems as an internist, as somebody who spends thousands of hours over many years kind of talking about this stuff and having to make sure that my diagnoses are right. Yeah. That's important for patients to know. They want to have the right diagnosis. Then the treatment kind of follows. If you have the right diagnosis, then the treatment tends to follow more easily. Yeah.
So I think what I hear you saying is that you're wanting to help people to open their minds more, to think more systematically the way you would think about something, and maybe less emotionally.
Yes.
And, interested in self-treatment.
Yeah, physicians and other health practitioners, and I say physicians, but there are nurse practitioners and physician's assistants and a lot of other healthcare providers that give advice, and patients and their families avail themselves and have had good results. But I want people to also understand that they have power, and not to be shy about. You don't have to know everything medical. If you have a toenail is discolored, you don't have to know all medical care, but you're able to figure out some things. It's not just by Googling everything. By the way, I do Google stuff all the time. I Google in front of the patients too.
Good.
So I tell people.
They're just like us.
Yeah. So I want people to know Google is okay. It tends to show you the worst of the worst, but it's okay to use Google.
Yeah. I like that you talk about that sense of empowerment, to not just like put a fire hose in people's faces of like warnings and bad news and information, and then leave people feeling like they don't know what to do with it. I think that's, not just with medical concerns, but with mental health too. Like, we have to feel like we have some sort of agency over, controlling our conditions and, taking care of ourselves, mental health wise, physical health wise. And I think that's definitely going to be a big, just a primary motivation for us to do this, is for people to really feel like they have some control and can have some say-so on what's going on.
People can't see me nodding my head through everything that Vanessa's saying, but I'm nodding my head. Absolutely. I want people to stay healthy and to figure out how to get data points, whether it's blood pressures or sugars. There's a bunch of techniques now that we're in 2022, there's a bunch of techniques. Some of it you have to get a prescription from a physician or medical practitioner, but a lot of stuff you can do yourself in terms of understanding what's happening with your body, et cetera. So, yeah.
I think the other thing you said too that I really liked is, just about things just aren't explained very well. Sometimes the diagnosis is just put out there and people don't really understand how it actually functions within your body, what can really be done behavior-wise, diet-wise, exercise-wise to control some of those outcomes. And then they just sort of trust that whatever medication is being prescribed from them is going to somehow help with the diagnosis.
Yeah.
And that's that can leave people feeling frustrated or scared or unsure if the one thing that they're told to try doesn't seem to be solving their problem.
Well, I even go before that. A lot of people don't know what their diagnoses are, and a lot of medical charts, people have more access to the medical charts now, the electronic health records. But a lot of people are shocked what's in the medical record about diagnoses. The obesity is a medical term. People think it's a derogatory term, but it's actually a medical term. But your body mass index of 40, morbid obesity 40 and above, for instance. But it's not that people are judging. Is that it puts you at extreme high risk for select things, strokes and diabetes and heart attacks and heart failure, arthritis, et cetera, sleep apnea. So a lot of people really don't know what's in their chart. I've had more than one patient not recognize that whenever I told them that they have some chronic kidney disease from their hypertension, and then they get the chart and they look at it and they say chronic kidney disease stage 3, they're shocked. They think, they're close to, they should be going on dialysis. And so for me to recognize that, me saying these words, chronic kidney disease or chronic renal failure or chronic renal insufficiency, these are all, the second ones are old terms. went over their head.
Yeah.
And it's a big deal because it shows end organ problems. Their organs that are being destroyed, partially destroyed from their hypertension. So they're shocked. People don't know when people go see a psychiatrist, they don't really know what's in the chart. There's a comedian recently, she had a long history of depression. She got a prescription for something called lamotrigine, which is an anti-seizure medicine, but it's also used for bipolar disease. And she before she took it, she looked at the product insert and went to her doctor, says, "Do you think I have bipolar?" And the doctor says, "Yeah, maybe you do." So that's how she found out. That's how she found out she was bipolar, is because she went and did her own little look-see at lamotrigine. And that's a shame that anybody should have to figure it out on their own.
Yeah, absolutely. It's destabilizing in some ways to have that announced to you all of a sudden. So I think definitely this, that the goal of empowerment and giving people that sense of autonomy they're in control.
Yeah.
That's awesome. All right. So we, kind of talked about what to expect, what sort of topics we're going to hit. Maybe you can tell us in a little bit more detail some of the other things that we're going to talk about. Obviously, generally mental health, the health system. We're not really going to talk about ketamine on here very much. We're, sponsored by a ketamine clinic, but we're not going to talk about ketamine very much because there's so much more to say.
We should say a little bit about ketamine, obviously, but the answer is it's far more than ketamine. As anything, if you pull on a thread, you undo the whole sweater. That's right. So it's all linked. So I want people to see the links, the linkages, and a lot of the stuff is going to be my saying some of how you delegate your time in your life between work and family and stuff. I'm going to ask some people to consider, I'm not going to demand anything, but consider rearranging some of their priorities because of the consequences are so significant, not just to them, but to their family. Because once somebody has a chronic illness, it impacts their ability to everything from participate with their kids, playing, to having sex, to making money. So, we'll talk about priorities in your people's lives.
Cool. How about guests? Are we going to have any experts on here?
Absolutely. We're going to talk to people that I believe bring a perspective, a real life perspective to what they do well. We'll bring on certainly my business partner to talk more about the ketamine, but we're going to talk to everybody from medical professionals to also regular folk that have helped me become the doctor I am today. So I'm looking forward to the stories from people that we touch their lives and they educate me every day. Yeah,
absolutely. Well, that's a lot to look forward to. So I guess I want to follow up just on the guests. Like, what do you think the value is of having, experts join us here, and what do you want folks to look forward to in hearing from those guests? I think everybody's an expert on something in their lives, right? But there's also lots of experts out there. We get a lot of, on social media, on the internet, and it's kind of like everybody's an expert on everything. Yeah. So how are you going to go about picking the people that are going to be here, and what do you want us to trust about your process when you're picking those guests? Well,
certainly we're learning along the way, but my purpose is not to sell people on anything, products, et cetera. I want people to see how our guests experience things, how they think through things, how they've survived, how they've flourished. So I'm looking for real life stories that are not sales pitches. I think that not selling products and helps people understand that there's some stuff that can be done without a lot of extra expense. It's just rearranging priorities and having better information.
Yeah. Okay, fabulous. So I'm definitely looking forward to that. I mean, all right, so we've kind of told you all how, who we are, why we're here. We want to give you a little bit of a little teaser on some of the stuff that you might look forward to. So we're gonna pose a couple of questions here to Dr. Tadros and have him expound a little bit for us so you can get a flavor of some more of the content that's going to be forthcoming. So my first question for you, Dr. Tadros, that I'm sure inquiring minds want to know: why does it take so long for my doctor's office to get back to me? Like, I just want to make an appointment. I just want to get a question answered. Like, why do they take so long to get it back to me?
Well, there's probably dozens of different reasons, but I generally categorize them as pretty dang busy. and poor systems and infrastructure. So even if people are very busy and have great systems, sometimes they have a hard time getting back to people, whether it's by phone or through their web portal. So that's the first thing. But a lot of physicians, a lot of medical practices, a lot of even universities that are where we send our most difficult patients, the most complicated ones, are not set up with good systems. They don't have enough people. They don't have the right type of people. They don't have the electronic systems. There are gaps, stuff that falls through the cracks. And that's where you have to advocate for yourself. And we'll talk about that, what it means to advocate without being too pushy, and when to decide to cut bait and run. Just sometimes it's not worth it. You recognize if this is the way it's going to be up front, that maybe you don't want to be part of that practice. Not because they're not good people. It's just because if the way it starts is the way it's probably going to continue oftentimes. There's a difference between a brand new patient where they don't know you, don't have medical records, versus an established patient where they have the records and stuff like that. So there's a big difference there. But there's no doubt, go where you're loved, and we'll talk about that.
Okay. So we shouldn't just give up out of frustration and never see a dentist or an orthopedist for a bone issue.
Now I know what you're going after. The quickie answer is no, and that's the frustration for people. They've been on the phone, they've sent in multiple requests. Some things are emergencies or semi-emergent. So we'll talk about some of these things. And sometimes it's nice to have outside people help you get in. Certainly, as a medical professional, I certainly have access to labs and other medical professionals, maybe outside the typical stream, that typical phone numbers that other people can use. But I also recognize the frustration of I entered my data, for instance, in my own physician's electronic medical record. Several years ago, nobody brought in my medication list. So you put it in, and somebody's going to check it medically in that office and check it, and make sure it's correct, and make it permanent. But a few years later, I go to another medical office that's on the same system. They don't know my medications, and it's because the first office didn't do their piece of it. So it's frustrating and adds time, energy, and frustration. And sometimes there's mistakes. Obviously, they assume that they have all the correct information. It's not correct.
Yeah.
So
I think it'll help people to be tenacious, and knowing the difficulties that medical offices are facing, just like any of our other workplaces.
They do.
However, to still advocate for ourselves and take care of ourselves, because it's not the office's responsibility to make sure I get my prescription refilled or my annual physical or any of those things.
Yes, there are systems. Some of the offices are very good with electronic medical record systems where they do have tickler reminders for them to contact you, or it comes to you directly, whether by your email or text or whatever technique. But in the end, I have to put things on my Google Calendar for my next colonoscopy. I don't just rely on my colonoscopist to remind me 3 to 5 years later, which is my next colonoscopy 3 to 5 years later. They kind of expect me to remember 3 to 5 years down the line.
For sure. Okay, so then I'm gonna shoot another one at you. So as a millennial myself, we were pretty much brought up with the mantra of follow your passion. Whatever we liked, whatever we were good at, our parents usually encouraged it. Our friends and family usually encouraged it. Teachers usually encouraged us to follow our passion. So, sometimes we can also feel a little bit rudderless, like, what is my passion? Or I don't really know if I have a passion. And it can make it difficult to start new things that maybe we aren't so passionate about, like healthier behaviors, exercising, eating better, quitting smoking, any of those things. I do not have a passion for giving up my favorite bad habits. How am I supposed to get motivated or stay motivated to do that?
Sure. I think a lot of as somebody who's treated depression for 30 years, not just with ketamine for the last 6 years, but I recognize that certainly there are some humps that to get started. The mountain you have, every molehill, every small hill feels like a mountain whenever people are trying to start anything or change anything. But it turns out that even though sometimes energy draining initially, it feels like it's sucking your will to live. There's value, and that's why you have mentors and coaches and spouses and partners to help you out. But the kicker is you have to be vulnerable to say, I'm drowning here, or I don't know where to start, or every time I start, it just is horrendous. And some people, it's help with medicines, help, first of all, with right diagnoses, and then sometimes with medicines, not always. A lot of times you need special counseling, and sometimes it is just plain old understanding that you're going to have to grind through some difficulties before you see some benefits, some positive effects.
So pursuing my passion is, or even a new thing that I want to try, is not always going to make me feel immediately good.
That's correct. So a lot of stuff, so whether it's passion for work, we can talk about that in terms of earning income, et cetera, but passions in terms of anything else, in terms of your health, in terms of family, in terms of spirituality, some of the stuff is not going to always feel right before you get the positive effects that for yourself or receive it in other people around you.
So if we were going to change the mantra from follow your passion, what would you want it to say?
I'd say follow your energy, and other people have said this. I'm not going to say anything dramatic here, but it's follow your energy. If you're an introvert, if you're in a public setting, social setting, you may feel decreased energy from that. So part of that stuff is I'm not telling people to avoid social situations or become a hermit, but to recognize that. And I think a lot of people just kind of push through some of the mental and physical signs and symptoms. And so I think follow your energy may be a little more accurate than follow your passion for a lot of things. And we can talk, it'll be fun to talk about these things and hear from the audience.
Absolutely. Okay, so don't follow your passion, follow your energy, folks. All right. That's pretty much what you got to look forward to. And if you want to get involved with the pod and let us know about topics you'd like to hear more about, you can go ahead and email us at notyourdocpod. That's NOTYOURDOCpod@gmail.com. We want to hear from you. We want to hear your feedback, what you'd like to hear about. Questions for the doc are always welcome. And we're going to see you again soon.
Yeah.
Thanks, Dr. Tadros.
You're welcome. Looking forward to talking more and seeing you again, Vanessa. Thank you.
Yeah.
This previous podcast represents my opinions and the opinions of my guests. This is not medical advice, and I'm not establishing a physician-patient relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each patient is so unique, please consult your healthcare professional for any medical questions that you may have.